Yeah, and a warm welcome to all of you who are joining us tonight at 7:01 Central Time. Welcome again to our third session of that continuing discussion around the consequences of gambling and how to avoid gambling within the African immigrant communities here in the United States. This conversation started about 3 weeks ago, and today, as we said, beginning into the third session of it, and we're having the regular faces who are going to help us again go through what the consequences are of gambling and how to manage gambling. So honored again today to have on the show. Welcome, Billy Benjaco. Hi, Billy. How are you?
Good. Thank you, Dr. Kari. Thanks for having me again. By now, I know the first time you said Dr. Oni was a friend of the TV station. By now, I hope you consider me also a friend of the TV station.
Oh yes. So now, oh yes, you're absolutely yes. You're now a regular contributor of KDL TV, and we are really honored to have you
Good.
as well. Welcome to the most regular person on this network, Dr. Richard Oni. Dr. Richard,
Thank
how are
you.
you?
I'm doing all right. Good evening, and I'm glad to be here the third time. And I know we still have more sessions coming up. And so tonight is the third sessions, and I'm glad to be part of it. Hopefully, we have a good time tonight.
Okay,
Thank
good.
you.
Thank you. So thank you, Dr. Oni. So let's go to the expert. By the way, the expert is the midist. So I'm to the far left, Dr. Oni to the right, far right. The person on the center is the boss, an expert in an area. So Billy is the expert. So Billy, for our viewers who are tuning in today or who missed the last two sessions, do you mind giving us a quick recap of what's gambling and then bring us to the context of what we need to discuss today, please?
Okay, so once again, good evening, everyone. So we started the first session by explaining what gambling is, and what we said was like if you are putting something as risk, something of value or money at risk with the hope of gaining something back, then that's gambling, right? That's the key word there is risk. Then we went on to describe how do you know when gambling becomes a problem, because it's not always a problem. Some people can actually do it for entertainment. When does it become a problem? And then we listed like if you're obsessing over the issue of gambling, like you're sitting down at the dinner table with your children, but your mind is thinking, oh, I need to go gamble. That's the problem. When people start to lie about where they are, when people start to be, become criminals because they want to gamble, when people become moody, there's a lot of mental health issues that go with gambling too. So those are the things to look out for. So having said that, then tonight we're going to go straight to how can you now help someone who is struggling with gambling. You've noticed all these steps, all these things that we mentioned. How can you help them? How can the person help themselves? Right. So the first thing you can do is if you suspect somebody around you is gambling or having some kind of addiction, it might be gambling, it might not be gambling. The first thing is just to talk to them about the problem, right? It'll be very challenging, right? But within the African community, there's always an uncle or an auntie or somebody that you can approach that I suspect that this person is having a problem. Can you talk to them? Like, well, all Africans, we know that sometimes there'll be one person that your child will listen to more than there'll be one person that your wife will respect so much that she will not be able to disrespect that person. There's one person that your husband looks up to that you say, if you cannot do it yourself, tell somebody who is able to talk to that person. I'm saying within the African context, right? And if you're able to do it yourself, just be prepared that you might not get a straight answer. The person might push back at you, but the first thing to do is open the conversation. And by saying that, look, I noticed this is a problem, and I'm concerned. I want us to talk about that. The person's first instinct might be to lie because they don't want to admit that they have a problem. Once again, like I said before, gambling is a disease of impulse, so they're unable to control their impulse. It's also a disease of denial. The person gambling might be in denial and not look at this is a problem, right? So after you've gone through either you talking to them or you asking somebody to talk to them, be mindful of your own approach. Don't be too confrontational, because if you're confrontational or condescending or you're aggressive, the person might pull back. So make sure you come from a place of concern and support when you're talking to them. Like, don't be aggressive, don't be judgmental, because then they would not be able to express themselves freely if you put up a wall front, right? And then one other thing, be honest and open. Don't beat around the bush. I want to talk about the gambling problem. Let's talk about the gambling problem. Don't go from A to D and to Z. Be honest with yourself. Stay focused on the subject, because the person will be pushing back, right? So you have to be honest with yourself too. Then let them know what you've observed. Let them know how you feel about what you've observed about them. I'm going to give some examples, right? You can start by saying, "Oh, you're my friend, or you're my husband, you're my wife. I'm upset because I see you doing things that are risky and harmful to you." That's one example of how you can do it. You can also go by that this route. "I love you and I don't want you to hurt yourself. Please talk to me about what's going on." Right? And you can also go by, "I can see that you're not happy and that makes me unhappy too. Can we talk about what's going on?" Those are just examples of how you can calmly talk to the person and provide support to them, right? Now, when all that is done, you may be surprised by the kind of reaction you get from the person. Some people might become very aggressive, and tell you they don't want to talk about it. This might be coming from a place of denial. This might be coming from a place of shame, right? But then you'll be surprised that sometimes the person would also show some relief that, "Oh my God, I've been trying to talk about this with somebody." So the fact that you go at them with concern and support, they'll be able to open up and tell you exactly what's going on. So that's one example of how to help somebody. Doctor, can you take the next one?
Yeah, bring on Dr. Oni to add on the same. Dr. Oni,
Right.
I'm sure you want to on that.
Well, a lot of time though, in the continuation or in a different format is sometimes people, how do we help people in a different way? Because a lot of time what happen is we are rewarding people for their bad behavior. A lot of time for my area of behavior management or helping people to use different approaches. Sometimes when issues like that happen, we want to quickly fix it for the person. We may say, "Oh, the reason why people gamble is because they need money. So let me give them money. Let me loan them money." I know sometimes when people are in distress and need some help, we quickly emotionally jump into helping them. And sometimes that's what they call when help hurts. Sometimes when help hurts is when you give some help that eventually help the person or make the person digress from what you are doing. So it is important not to use the approach of say maybe they need money, let me loan them money. If you loan them money, where would they get that money back or pay you back? That is the time again that people will say, "Oh, I better gamble so that I can pay my debt that I owe my friend." So in order to avoid that, it'd be easier to say, "I know sometimes you struggle for money. Maybe I can pay some of your bill. If I pay some of your bill, if you stop really, maybe reduce or not even gamble, I can pay some of your bill." If you do that, that may help the person. But again, we need to be careful because when you do that and they don't have bill to pay, then they will now say, "I don't have bill to pay. I just go and gamble and take money for fun." So sometimes it is important when you give money like that, it is important to let them know that the purpose of that money is to make sure you don't run after money unduly or unnecessarily or in a bad way. So when you do that, it will help the person. But in addition to that, when you say, "I want to help in a way that is more positive." But remember, sometimes when we talk about compulsive gambling, they become emotionally and psychologically addicted. That means no matter what happens, they will still find a way to do it. So it is important to also enjoy talking to them to tell them the reason. If people don't know why you give them this money, they may think you are encouraging them. No, you are trying to help them out from that issue. But remember, there's some psychological addiction to that. And sometimes when people are emotional about it, it's very difficult to change. A lot of time, behavior that you learn for several years is difficult to just one day unlearn that behavior. So it takes time. We need to be more patient. And we need to also be very frank in doing that. There are some times when people say, well, how do you encourage them to get help? Because this is the time, if you try to solve people's problem and they know they are a little bit relieved, that is the time you can now introduce some treatment or some help. And you can do that by encouraging them to seek a professional help. Sometimes people don't receive help because they don't even know how to receive help. So it is your job when you want to help them to that level to also find different way. You can offer some support to see a counselor. And when they are seeing the counselor, this is the time you also need to encourage them to continue to follow the process and the protocol that the counselor might have recommended. I know in American way, that's what we call HIPAA, and so they don't tell other friends your issues. But sometimes, if you trust somebody, you might take them to some treatment to say, hey, I can find somebody that can help me when I get back home so that they can remind me of some protocols to do. So you can say, hey, if you need me to help you or go with you to some treatment, let me know that. I know America will say no to that, but in our African concept, there are some people you may trust. So try to reveal those things to them, and you might be able to get help that way. The sooner we receive those type of help, the better. In any treatment, if you don't receive help on time, they continue to perpetuate. So that is my own recommendation in that area.
Okay, thank you, Dr. Oni. That's a very fascinating discussion. By the way, I'm also like a student listening very attentively to what you're saying. I want to pick back to Billy, what you're saying. And I did highlight a key point in your presentation, and Dr. Oni as well as mentioned the need for being trustworthy. But you also did mention the fact that you need to be honest to yourself. Do you mind expounding on that concept? Why is it very important for people to be honest about themselves and the reality that is associated with gambling?
Concern. You need to be honest yourself that look, genuinely am concerned about you. You need help, right? The person on the other hand, like I said before, gambling is a disease of denial. So that person gambling, most of the time they're not honest with themselves. So they're in denial of what is happening. So you as a person that is uh, propping them to seek treatment, you need to be honest and open with them. That's what I meant. However, I wanted to add one more thing. Sometimes when you are trying to get them to commit to treatment or to seek help, you might find out that they become really aggressive. This is what I advise. If you become so aggressive, pull back, take a break, stop pushing, right? And then all you can do is let them still know that you love them. You're coming from a place of support, and then provide them with the information, like you have the resources, then give it to them that if you decide to get help, this is where you can get help. And another thing that I've noticed, people that the family members or the friends of the person gambling, they always feel so like guilty. They think it's their fault. Dealing with somebody gambling is becomes really exhausting, right? I just want people to know that it's not your fault, right? The person that is gambling is not going to stop gambling until they are ready to stop gambling. So no matter what you do, if they are not ready to stop, they are not going to stop. So some people always blame themselves. I should have done this. I should have done that. No, you are not to blame, right? The only person that can stop gambling is the gambler. And then one other thing that I would advise people to do is, when I say be honest, is the gambling, the person is not the problem. It's the gambling that is a problem. So if you approach it that way, you know that this person is gambling, but that does not mean they're bad. This person is not a bad person, but they are taking bad decisions. If you make them see it that way to separate the gambling from them, then maybe you could get a headway.
Billy, I'm gonna stick
That's
stick
true.
on So I'm gonna stick with you. Sorry, I don't mean to ignore Dr. On. I'm gonna stick with you for a few more minutes. You know, yesterday after our conversation, I went on and I was doing research, and I had a chance to listen to Ken Rogers. Ken Rogers has this hit about gambling, right? And I did send to both of you, and where he was talking about the gambler. That one thing that the gambler needs to know is that the right hand, you have to understand that the right hand can make you win, and it can also make you lose. That is something that you have to understand. That, and further, what he was saying is that what you need to know in your mind is at the end of the day, the gambler only dies in his sleep and with his cigarette on on his hand. So I did send that to you, the gambler, and our viewers can go ahead and watch Ken Rogers, the gambler, and I think that's consistent to what Billy and Dr. Oni are talking about. So, Billy, to the same again, what is the responsibility of family and community in as much as it's personal responsibility, but we do understand that the African community, that African socialism, what's the responsibility of the family and the community in ensuring that somebody does not die in or her sleep because of that?
So that those are the things I've talked about. These are the ways you can open the conversation. However, because we're in the US, if it was back home, is a different story. But because we live in the US, after taking all these steps, if the person still refuses to go to treatment, you cannot commit them. You cannot force them to go to treatment. So, like I said, just like keep the communication open, and don't stop talking to them about it, right? But at the end of the day, I mean, some people might decide to even stop talking to you because they don't want to stop gambling. But there's really so much you can do aside from showing them support and concern and giving them the resources they need. You cannot drag them to treatment. And as a community, what we can do is what we're doing right now. Spreading awareness, letting people know that the resources are there, letting people know that there are people that can treat this problem, right? And it's not and then, I mean, we need to, like I said earlier on, we need to talk more about it. We need to remove the stigmatization. We need to normalize these conversations so that people will be confident enough to admit that they have this problem, or family members will identify people that have the problem.
Billy, I'm
That's
gonna come to
good.
you. Billy, I'm gonna come back to you in a second to talk about treatment, but I'm gonna have Dr. Oni chip in. I know Dr. Oni is a community man, and I think within the African immigrant community here, he's pretty much everywhere you want to mention about, and there's a very powerful voice. I think he has a very powerful community opinion. So, what do you say to the community in respect to the same, Dr. Oni?
Well, I will go in straight to the barriers. While in the community, people will say we don't have issues, but then they have issues. So I will talk about what are the barriers, what are the obstacles that stop people from gambling, and what are the issues that we need to address when it comes to those obstacles. And one of them is because, like Billy just mentioned, people deny. When they deny this, they will not look for treatment because they did not see what they are doing as impacting or affecting other people. So this denial is one of the crossroad to receive treatment. When you say, I don't have this, I don't feel sick, then people don't receive treatment. But why do people deny? It's because of the shame attached to that type of behavior. Sometimes they know that this behavior is not okay, especially the compulsive gambling part. They believe that when people find out, they will be ashamed of it. So for that reason, that is why they deny. So denial and the shame associated with gambling is a different way of looking at it, and that causes a big barrier, a big obstacle to receive treatment. The other aspect of that is lack of trust in the system. People say there is a barrier, there is obstacle, is because of the fact that they don't trust the system. In the African community, there's what they call gossip syndrome. How will people say? How will people know about this? How many people will know if I told Dr. Oni that I have this issue, or if I told to talk to Billy about this? How many people will Billy, send this to? The same thing with Dr. Oni. So they don't like the system. And then when you go to the system, They will now say, "Oh, this is gonna be my record. If something happen, they will go to my record in the clinic, in the hospital." So people are afraid of those things, and because of that, they are not receiving treatment. The other part of the obstacle to receiving treatment is lack of understanding. Sometimes, if you don't understand your illness, it will be difficult for any doctor to treat you. That is why it is important that we are having this awareness and the problem that problem gambling can cause in the family, in the community as a whole. So lack of knowledge of the illness is another obstacle. So it is important that we know. If someone said, if you are experiencing headache, you know you have that headache and you know you can receive treatment. But this part of this that you deny already, you cannot deny headache because it's pounding on you and you are having pain. So you are obligated to take Camaquin or whatever medication you want to take. Now, it is also important for in Africa when you have malaria, you already know you have that malaria, and so nobody need to preach to you. You can receive treatment. So also in the gambling, if people don't understand that, they may not go for treatment. The last part of that, which is there are more, but I just want to give some examples like that. The other part is lack of awareness of the resources available. For example, this treatment of gambling or compulsive gambler is free. You don't have to have insurance. You don't have to have personal money to pay. So these are the resources that can help people to really get well. Thank you.
Oh, good, good. Billy, I'm gonna come back to you again because I think, like I said, you come with a lot of professional experience to this discussion, and I think what you say, our viewers will really take that very seriously. So, to add on to what Dr. Wanda was saying, and again, let's underscore one fact here, in all seriousness, that when we talk about gambling, it's not just the exchange of money with the aim of getting money. There is a lot that is associated with it. So you're talking about different addictions. For example, you're saying you're spending more time away probably from your family. That is not a good thing. And then you are saying probably you are indulging in a lot of drinking, which would be catastrophic. Your choice of friends is also problematic, and maybe could be that you're going through some psychological problems by going to the casino to gamble. That does not help at all. In fact, what it does, it even adds more into more stress on really gambling. So, what other options are there available for treatment, Billy?
Before I jump into treatment, I want to add something quickly to what Dr. Oni said, as the fact that people don't trust the system, the stigmatization. We have this general belief in Africa. I'm sure most of Africa, when somebody even has a headache, they don't want to tell the next person that they have a headache. When someone is struggling with diabetes or high blood pressure, it's like, oh, this is shameful. I'm not going to tell anybody. Not to talk of mental health issues. So that's another narrative that we need to, change. I just wanted to add that quickly. As far as the kind of treatments available, there are different types of things that treatments that a person struggling with a gambling addiction. Number one is psychotherapy, right? Because it involves counseling. So, like, there's this kind of therapy called cognitive behavioral therapy. It's called CBT. It's been known to work well with somebody that is gambling because CBT just like helps you to restructure the way you think, right? As another kind of therapy that is good with gambling is family therapy, and I'm lucky that I'm a family therapist as long as a gambling addiction therapy. So when somebody comes to me, I go from the systemic part, to look at why is this person gambling. I go back, to pinpoint why the person started gambling in the first place. Try to connect. Is there anything in the family system that led the person to gambling? So then when I figure that out, then we'll try to resolve that before actually going into the gambling. So that's one thing. Another thing that works for gambling addiction is medication. It doesn't work for everybody, but sometimes people have a comorbidity, like somebody that is having a gambling problem also is struggling with anxiety or depression or ADHD. So medications like antidepressants that help with these things can help alleviate those problems. Like, so if you are depressed and you're taking an antidepressant, and your depression is caused by your gambling, so when you take the antidepressant, it can actually relieve the gambling problem, right? Other medication that is used to treat people dealing with substance abuse, some kind of narcotics, also help with the gambling. Another thing that helps is the self-help groups. I know everybody knows about AA, Alcoholic Anonymous, but people don't know there's also something called GA, Gamblers Anonymous, where people that are gambling meet on a weekly basis just to talk about what's going on, what led them to this. So it's a self-help group, meaning that it's run by people that are gambling. There's really no, like, I can be a part of a GA group, but like, so that also helps too. And then we have inpatient treatment, like, how people are addicted to substances, where they actually go in for treatment for like 30 days or 90 days. Actually, treatment options like that for people gambling, where you would have therapy, you have group, you have everything resident there for like 30 to 60 days. So those are the kind of treatments available.
Yes,
Thank you.
and
Go ahead, Dr. Did you have a...
well, in addition, I mean,
Yes, go
Billy
ahead, Dr.
covered, and like you said, when illness happen, it becomes family issues. So a lot of time, the support from family is also a form of treatment, because the stigma that come from outside, if it's not coming from inside, then you have more opportunity to say, okay, I'm feeling this way, and you feel very relieved that you are not being ostracized by your family. So the support also is a form of treatment, and especially for African issues. We know anything that happens within the family is a family issue, and that, I think, is very, very important, that we help gamblers in that way. And within the family, there are so many things that can happen, but the moment the family rejected you, that is when the more issue happen.
Okay, I want to bring in Billy. Sorry, people are texting me questions here. So I received one question here, and I'll try to read it. I'll forward it again to Ben to put it on the screen. The question is, do people gain from gambling? We've had some people brag about gaining from it. Please expound. Some people think if you go there, you're going to be a millionaire. No, Billy, you want to expound on that?
This is where there's a cross between gambling for entertainment and problematic gambling, right? If you go one time and you win big, and you take your winnings and you don't go back to the casino, that's not a problem. That's not what we're talking about. But if you go and you win big, right, and you now go back and bet all that money and you lose it again, then you keep going back to try to win it back. That's when it becomes a problem. So I mean, if you go one night, just to gamble and you win big, like you said, Dr. Okari, you did at one time, that's not a problem, right? So and then there's some people that are like, they are professional gamblers. Like, they play poker, they do it as a profession. Those people are not addicted. They are thinking, like, they're thinking straight. They want to win that money. That's what they live on. That's different, right? But like I said, there's a thin line between entertainment and it becoming a problem. That's why you have to be mindful and to kind of like assess yourself and say, okay, this is becoming a problem.
You know, how on that?
How is it affecting you psychologically? Because you are so addicted to it. And that is the area we're talking about, compulsive gambling, that is becoming a problem. That is why we call it compulsive. So that means you don't even think about it. You just go straight because it's been part of you. That is different. And that is where we are paying attention to, that people need to really avoid that.
So thank you. I have two questions here. Sorry, I know we're running out of time, but I want to pose another question here. Billy, to you. You are the expert, so everybody, the questions are directed to you. so, sorry. So the question is from Jane Gamba. Jane, please post that on Facebook as well. She's asking, if gambling is bad, why are there thousands of people flocking in casinos?
Okay, so The casino always wins. I hope you know that. And all those thousands of people flocking the casinos are going there because they're hoping to win something, right? But not like more than half of them are not winning anything. They're just pouring money into the casino. That's one thing you need to know. That's the addictive part of it. People keep going, but the casino always wins. You go there, you spend money, you eat there. They even offer people like free rooms so that you come and spend money there. But just know that most people going there, they're losing money. And some of them are in distress, but they are not showing it. Do you understand? Yeah, I mean, people go there. It starts out as entertainment for some people, but then they get hooked, and that's what the casino wants. I mean, there's some casinos that don't even have like there's no windows, so you don't even, you lose track of time. They don't have a clock there, so you don't even know what time is. You don't know anything. They just want people to come in and continue putting money into the casino.
So one last
No
question.
window, no windows. Wow.
I know we have
What?
3 minutes per time, but Billy, and I think you can share this, Billy, to you. They're saying sometimes groupthink can be very problematic. If you put people into small groups as a support system, that can be problematic because they think as a group. In other words, they're not thinking outside of the box. But then there are also those ones who are thinking from quote unquote out of the box. They might say, as a community is, look at those addicts, those drunkards. How do you deal with that? That's the last question. I hope both of you can share that.
Are you talking about like the self-help groups? So for those, like I said before, is run by people that are gambling, so there's no stigmatization. It's an atmosphere where you can freely express yourself. So I mean, if you find some people to even feel more comfortable, some people might find a GA group that's far from where they live so that they feel more comfortable in it. But I think as time goes on, we as Africans are actually form our own GA groups too, where everybody is African and we know that this thing, there's no more stigmatization where I need together and where I need to get better. So that's like I said before, we just need to keep changing the narrative about mental health in general, about psychotherapy, so that people feel comfortable and don't feel, oh yeah, people are going to be looking at me somehow if I join this self-help group.
Good. I know we are running out of time. Dr. Oni, I'm sure you want to chip onto that before Billy finishes up
Well,
for us today.
well, I mean, like Billy said, it's a support group, and so everybody's equal. No one is bigger than the other. No one is better than the other, and so they can support each other. No stigma. No looking at you that oh, you do more than me. No, we are here to support each other, and people will share their experience, and other people will learn from there. Even though there's some behavior management that says if you put bad people together, they will learn bad behavior. But this one is different. This is where people confess their sins. They confess what they are doing and they learn from that to say, I did this and this is what happened to me. So other people learn from this. This is different from just saying, pointing finger, oh, you are a drunkard. No, this is a place where it's a safe place for them. It's a safe place with no stigma attached to it. So we need to just now look at that, and I think that is another way that people cap out to say, they have to find something negative about the treatment. And that is what we are hearing when people say that. Those are the people that don't want to change. And like Billy said before, we cannot change behavior. We can create environment for a change of behavior. Until a person is ready to change, that is the time the change will happen. Whatever we say will not, but we will create that environment for them to think twice about that behavior that is compulsive and causing them bad issues within the community.
All right.
I hope
Thank
that
you.
will help people.
It does. As you talk, I'm sure there are so many questions that are coming up. And again, because we have another 1 or 2 sessions to come, I think we can request our viewers to post their questions there on our comment section. Then we can have those answered maybe the next time we meet. But for now, I'm going to let the expert in the group, Billy, to make a closing statement.
Dr. Carey, for allowing us to do this, and I'm excited that the community is getting involved by the questions we're getting. Like you said, if anybody has a question, you can post it to the KDR TV Facebook page, and then we'll address the questions in the next segment. The next segment is actually going to be the last one, so we want to take as many questions as possible so that people will know where to get the resources. And we're going to talk about our own clinic too, so that to know for people to know where they can go to for help. Thank you.
Billy, sorry, I have to. Again, I just received another question. I'm sorry. We're going past time, but for the sake of the community, it looks like we need 3, 4, 5 more sessions. So here's a question for you.
Okay.
Here's a question from you from Collins Ompuro. Collins is asking Billy, how can you make your spouse not go there? Because I've had relatives because of gambling.
How can you make your spouse not go to the casino?
Heard of so
Is
many
that
relatives
the
of the
question?
yes, because
Huh? So
yes,
So, like,
yes.
I don't know if this person joined us from the beginning, where I explained how, as a family member, you can talk to your spouse. So, for instance, now, if you are, let's say, it's the woman that is trying to convince the man, you can enlist the help of somebody, an elder in the family, or a trusted uncle. Like Dr. Oni is like a community leader within the Nigerian community. You can enlist people like doctor to talk to your husband, and then maybe see how that goes if he's not going to listen to you alone. So there are ways you can do it. I know you are a woman, you know how to get through to your husband. There are ways that you can do that he will listen to you. So, well, that's all. That's all. Everybody has a unique situation. Let me just put it as that. Yeah,
And I know
but it's
you've been very
doable.
diplomatic. Billy, you're very diplomatic with that response. Let Dr. Oni, Dr. Oni, on the same.
Whether it's a man or a woman, what it says spouse, but at the same time, there are some ways you can express yourself about something that you are not happy about. Like you said, you don't have to be aggressive about it. But maybe if there's a parent to when he goes, maybe that is the time you are going to engage him or her to do other things instead of going to that place. Maybe that's the time, if you have children, maybe that's the time you can go for a walk, or maybe you can do some activities. You have to follow, you have to study the pattern that is happening so that you can create some opportunity to make that change. It's hard to know individually, but you have to come up with some menu of reinforcement for that person. You just have to come up with series of reinforcement techniques to create that opportunity for not going. So, well, maybe this is kind of thing. I wish we could dialogue with each other so that we can all say, maybe that person can tell us exactly what is going on, and then we'll be able to support differently or come up with different approaches. So, but since we cannot do that now, we have to make do of what we have. So, find some different avenue to discourage that.
Okay, good. And as long as you don't get accused of spousal stalking, that's important to take care of that. So again, guys, I think it's good to say that marks the end of our discussion for today. And then obviously we have another session next week at 7 Central Time. I think we hope our viewers do join us then to, I think, what we might have as the end of the session. But if we're going to have 1 or 2, 3 more, that would be great for our community. But again, I want to thank you, Dr. Oni, as always, and our dear sister, Billy Benjako. Thank you so much for doing this again. We'll talk next week. And to our viewers, thank you so much again for being on with us. As we promised last week on Sunday at 11:20 Central Time, we're going to have a very interesting discussion. And that discussion is going to be about this wonderful sister of ours down in Houston, Texas, Stella Kinama, who has written a very nice book. I think, as you see it over there on the screen, you can see as well on my end, The Abused Queen. And I think this is all about domestic families and domestic violence, how sometimes it gets to extreme ends. And I think we're going to have a very emotional discussion on Sunday. So we hope you join us again on Sunday at 11:20. But also on Sunday at 10:20. Quite frankly, we started with that one. Our friend here in the Twin Cities, Pastor Lee Nyaberi, has also written a second book here, a very beautiful book. I've read this book about 3 times, How We Move Beyond Mediocrity. And I think that's a problem that we have here. What is mediocrity to begin with? We'll dissect that and go into the details of what he's talking about. It's a very powerful book. Like I said, I've read it several times, and I welcome our viewers to join us on Sunday again from 11:20 a.m. to 12:20. We'll be talking about the 2 books, so hope you join us again. Don't forget, before you hang, just go to YouTube and subscribe. All you need to do is just click that subscription button, and that's all you need to do. And then on Facebook, KDR TV, go there as well, like us and make comments as best as you can. And more importantly, we're welcoming constructive feedback, so as we move forward to having more regular programming here on KDR TV. Don't forget also that we are on Twitter. Follow us there as well. If you have any questions and or comments, please do post it there. But for now, I want to thank you for allowing us to be on your smartphones or your laptops and your homes. We hope to see you again here on Sunday at 10:20 Central Time. Again, it's Dr. Jeremiah Okali for KDR TV. Thank you.